I'm Dr. Sheehan from Sheehan Natural Health Improvement Center, and we're going to do another case study. This one, nutritional blood chemistry and design clinical nutrition assessment. This is one for a 66-year-old male, overweight, depression, neuropathy in his feet, muscle and joint pain. And so a little bit about his history. I wanted to give you a case study talking about the importance of taking family history and knowing a little bit about them. So he came to see me, and it was like 15, 20 years ago, and he did well, and he stopped coming in. And in the meantime, he had been diagnosed, I think, as diabetic and put on like 50 pounds or something like that. And so he called up, wanted to make an appointment. A little bit of an aside, the reason why he called up, in our office, Sheehan Natural Health Improvement Center, we put out a weekly newsletter. And this newsletter is not sales. This is a newsletter based on, hey, I think patients need to know this. And so we write something, either myself, Laura, or even Jen does it sometimes. And so it's just basically a communication tool of getting them to know things that they need to know to get better. And people love it. I ask people, I'm like, are you reading them? And they're like, yeah. And so I said, are you reading this? And he said, yes. And that's the reason why they came back. Actually, he and his wife came back. And his wife is another case study. She's doing much better. She's got a history of 5 years of shingles in her face. Right along the gallbladder meridian, guess what she had out? Her gallbladder. So we're working on her gallbladder. Anyway, so back to this person, okay? So I wanted to let you know that's how he came back in from our newsletter. If you want, you can sign up for our newsletter. Any of you practitioners out there, you can go and take our name off. It's nice if you give us credit, but you can use our newsletters. People love them. Anyway, so let's go to the next one. Let's see, how do I make this? There you go. Okay. So 66-year-old male, overweight, depression, neuropathy in the feet, muscle and joint pain. Remember I said that he had a history, important thing, case history, and he's like, well, I was diabetic and I needed medication, but I don't need it anymore. Neuropathy in feet, what do you think? Diabetic. History of shoulder and knee replacement within 2 years. We start thinking joint pain, think diabetes. Triple heart bypass 6 years ago. Insulin resistance, that's the number one thing that does that. Okay, that's the number one cardiac risk factor. So let's cover how we combine history, symptoms, nutritional response testing, and nutritional blood chemistry to develop a designed clinical nutrition plan for this patient. So let's go over his family history. The intake form is sparse where family history is concerned, so you should ask the patient thoroughly about this in the initial patient visit. You want to ask about their family history of cancer, diabetes, heart disease, autoimmune disease, thyroid disease, and mental health issues in all first and second degree relatives, siblings, aunts and uncles, parents, great aunts, uncles, and grandparents. This will really help when I asked this patient about this. I honestly don't remember exactly what he said, but what stuck in my mind was already diagnosed with diabetes, said he doesn't need it anymore. Okay, I'm like, we're gonna look at his blood test for that. And then also, I'm gonna show you a couple of little surprises here. Actually, I know his daughter, and his daughter was diagnosed with hypothyroidism, Hashimoto's. So I'm like, could this person have diabetes again and Hashimoto's? Because that would be one heck of a problem. Okay, the patient's family history is remarkable for cancer, diabetes, and heart disease. And like I said, his diabetes and his daughter's Hashimoto's. In this case, it would be important to ask about family history of thyroid disease due to the patient's elevated thyroid antibodies, both TPO and thyroglobulin. We're going to look at that. By the way, when you do that, if you're a doctor and you want more patients and you find one person with Hashimoto's, you got to check the whole family. A lot of them will have, well, maybe not a lot of them, but there's a much greater incidence of Hashimoto's among other family members, and they're usually very symptomatic. Okay, so next thing you know, you can have a lot of referrals, and that's exactly what happened. So his symptoms, chief complaints, patient's primary symptoms were he's overweight, he's about 50 pounds overweight, foot pain, he was diagnosed with neuropathy, knee pain, muscle and joint pain, and erectile dysfunction. He had to come in with a cane. By the way, he doesn't need a cane anymore. It's only like, I think it's 4 or 6 weeks into it. So this is his symptom survey. When I look at this, I don't look exactly at symptoms, but I look at numbers. And you can see here, okay, so this is group number 5, all right, which is what? Liver. Okay, so that's a high number of 8. That's how I basically assess these things, like where are these things clustering. So liver, what's associated with liver? Well, thyroid and insulin resistance. And then you look over here, increase in weight, decrease in appetite, fatigue easily. So we're looking at thyroid symptoms here. And then we're looking over here at group 8, which is basically more gallbladder and B vitamin, basically, and then thyroid, okay? And male hormones too. Actually down here, I don't have the, I can't get my head out of the way, my big head, but his male hormones were pretty high too, okay? So scored relatively highest in the liver, hypothyroid, and male hormonal categories. Remember, thyroid hormone, from going from the inactive T4 to T3, 70% of that conversion is done in your liver. So you're going to see thyroid and liver gallbladder go together like peas and corn, like peanut butter and jelly, okay? I said peas and carrots, actually. All right. So nutrition response testing. This patient was blocked due to the 6th stressor. An AK challenge was determined for essential fatty acids. So this is something I picked up when I learned some of the AK, not a master at AK. But what you do is you take a blender and you put in a couple tablets of aspirin, acetaminophen, and ibuprofen, grind up in a powder. That acts as another stressor. What that shows is a defect in the fatty acid metabolism, the omega-3 fatty acids, basically. I'm trying to remember it all biochemically. You don't need to know it. But what you do need to know is that it's an imbalance of, I think it's the prostaglandins, and I forgot the exact names of them. I think it's 1, 2, and 3 actually. But anyway, there's an imbalance between the anti-inflammatory and pro-inflammatory pathways and the analgesic and the kind of like pro-pain pathways. Okay, so you're looking at a problem with the inflammatory pathways with the omega-3s. And so when that tests, you're going to test the things that have to do with omega-3 fatty acid metabolism, which is B6, magnesium, and zinc. Those are the main cofactors. Okay, and then the fatty acids, which are, of course, the omega-3 fatty acids, such as would be like flaxseed oil, fish oils. I'm trying to think of some other ones. So basically, for standard process, you're going to look at flax oil plus what we used to call Cataplex F. I think that's called something else now, Cataplex F pearls especially. You could do Cataplex F tablets. You could look at the tuna, calamari. I use a lot of the Oprima EPA DHA, and Oprima DHA. And the other thing that you test, you see a lot of, is black currant seed oil, because it's high in gamma-linoleic acid, and that's what he tested for. That basically shuttles your prostaglandins into the anti-inflammatory pathway, rather than being the omega-3 fatty acid that makes those prostaglandins. Okay. Okay. So let's look at the Sheehan panel. No surprise here. What does he have? We're looking at insulin resistance, so he's got borderline diabetic glucose, borderline diabetic HA1C. Right there, insulin resistance is a big problem. You can also look for his insulin resistance. Where is it? Okay. So we're also going to look, he also had high fasting insulin. I can't find it on here. I think it was on the previous page. But you can also look at, he had very high triglyceride HDL ratio. Remember, that ratio shouldn't be over 2 to 1. It's actually better 1 to 1. And also, if you look, his triglycerides are very close to his cholesterol. So we're looking at an insulin resistance problem here. And then if you look here, he's got anti-TPO and anti-thyroglobulin antibodies, which means that he's got Hashimoto's. And the reason why you run these is not just to know whether he's got Hashimoto's, but also because of the fact that that means that he's actually a food case. He needs to avoid all gluten and dairy until he does a Cyrex test to see exactly what he's sensitive to. All right, remember that. That's clinical pearl. So this patient, so the reason why I wanted to highlight that, by the way, he's also hypothyroid. He's got TSH of 5.93, low T3 uptake, low T3, and high reverse T3. The inflammation is turning his active T3 into the evil twin of reverse T3. Remember, we go over that in the course. So the reason why I wanted to highlight this case was because of the fact that knowing that he's Hashimoto's and he's eating those foods that he shouldn't, and he's basically diabetic, you know that if you just make strict dietary changes and give him minimal supplements and time, okay, remember with diabetic patients, they need to lose about 20% of their weight to reverse their diabetes. I think it's 93% of the time. If you give him time, okay, things will reverse. Also of note in this case that I should talk about, like I said, hypothyroid. He's got fibrinogen high, a little bit high, so he's got a little bit of inflammation. His homocysteine is very high, but if you look down here, his folate's pretty low. You'll also see this a lot in patients with Hashimoto's. A lot of them need folate and B12. I've seen this. Not sure exactly what the pathway is, but it is true. A little bit high eosinophils and monocytes, probably because he's eating foods that he's sensitive to. He's got thick blood, high red blood cells and hemoglobin, but he also had some high inflammatory numbers. I think his ferritin was high. So let's look more at this. Yeah, and you can see his wheat is high, his casein is high, and his fasting insulin is real freaking high. His HOMA-IR, that should be a 1 plus or minus 0.5, is an 8.34. He's severely insulin resistant. This guy's got a problem, okay? When you see, I'm going to tell you a couple things here. I have eggs on here on the food sensitivities. Notice that gluten did not come up. I just don't believe it, quite honestly. When I see a patient with Hashimoto's, I've seen them get so much better when they stop gluten and dairy. I'm like, you're stopping this, whether it says that you're sensitive to or not. Until we run the Cyrex, even then, I'm like, I've just seen much better results. I've seen thousands of patients, hundreds of patients with Hashimoto's. They do very, very well. But when you see something like this, it just means it's going to take time, okay? So what did we find? Food sensitivities. It says waiting for IgG results. We figured them out and put them in here. Positive thyroid antibodies completely cut out gluten and dairy. 100% of your diet. Total protein, borderline high globulin, high calcium phosphorus ratio points to digestive dysfunction, gut inflammation, and also high carbohydrate intake. Blood sugar, high fasting glucose, high fasting insulin, high HA1C, high HOMA-IR, and high triglyceride HDL ratio point to severe blood sugar stress and insulin resistance. Start free foods or page. I put them on the free foods diet, I believe it was. Maybe page phase 1. They're very similar. As long as the other clinical pearls is, if you have a diabetic patient, you put them on the diet and they start losing 0.5 to 2 pounds per week, you're on the right diet. That just means it's a time thing. And that's exactly what happened to him. He's losing like 1 to 3 pounds a week. I also put him on exercise. I said, what can you do for exercise? He's walking with it, or he was walking with a cane. And so I can't have him do a lot of walking. He said, well, I got an exercise bike. I was like, do half an hour a day gently. He's like, all right. That was it. It says start walking 1 to 2 miles a day. You can't do it, so he bikes. 1 to 2 miles a day, you're going to be doing 15 minutes to half an hour. So I'm like, just bike half an hour. He's like, okay. Immune system inflammation. He's got high monocytes and high eosinophils, point to an immune stress. High homocysteine, high fibrinogen, and high ferritin point to inflammation. And of course, yeah, he's inflamed. What are the things that cause inflammation? Food sensitivities, poor digestive processes, high refined carbohydrate intake, insulin resistance, also immune system challenges, which could be the foods that he's eating. And then the other thing can be an iron imbalance, but also when you see low folate and B12, that will actually cause inflammation. So he's got all those, okay? Nutrients, he's got low B1, B9, and B12. Remember, the low B1 pattern is low CO2, high anion gap, and what is the other one? High fasting glucose. So he's got a low B1 pattern as well. Remember, he's got hypothyroidism. By the way, he's on medication, okay? I think he was on medication. But he was still hypothyroid. So when you go, one of the things that will happen is that inflammation will, part of the autoimmune process is inflammation, and it'll cut down that T4 to T3 conversion. The thing is, if he's high in reverse T3, that means that he's got enough T3, but his body is deactivating it due to the autoimmune process and inflammation. And so when you reverse his insulin resistance, you get him exercising, get his digestion right, stop him from eating those foods, his TSH will go down because his T3 is going up and T4 is going up. Got that? It's really important. He's also got high ALT and AST and high GGT, points towards severe liver stress, fatty liver. When you see, remember, when you see ALT higher than AST or GGT, you're looking at fatty liver syndrome. Okay, it's what he's got. He's got low GFR and high creatinine and high BUN, point towards moderate kidney stress and also dysbiosis. Remember, you'll see BUN go up when you've got dysbiosis. And cardiovascular risk, he scored 13 out of 15 for cardiovascular risk factors. And you can see the general, this was done by Jen. She is awesome at doing this, not me. The main things to handle are cutting out gluten and dairy, handling severe insulin resistance by cutting carbs, sugar, and walking. He's going to do biking. And handling the liver and gallbladder stress. Start the free foods or page phase 1. I can't remember which one we did, but it's working. And avoid gluten and dairy. This will help balance blood sugar, nutrients, and cut inflammation. Start walking 1 to 2 miles per day. He's going to bike. Use muscle testing. Check for the need for digestive support, liver, gallbladder support, B9, B12, thyroid support. And order the follow-up panel in 4 months. So this is what I found. We put him on the phase 1 diet, cut gluten and dairy, bikes half an hour a day, and I used 3 supplements for him, and that's it. SP blackcurrant seed oil to address inflammation takes 9 of them. Remember, that helps the anti-inflammatory pathways. He tested for that 6th stressor, which is the aspirin, acetamin, aspirin, acetamin, and ibuprofen vial, which means that he's got an imbalance in his omega-3 fatty acid prostaglandin synthesis. Remember, that is the B6, magnesium, and zinc as cofactors. And then what you want to do is test for essential fatty acids, especially fish oils. And from standard process, you're going to look at tuna, calamari, All-Prima. Remember, All-Prima EPA, DHA, also flax oil plus, and Cataplex F pearls. I forgot the new name. Maybe that is flax oil plus. You get the point. And also blackcurrant seed oil. We use doctor's research B-stress complex with him because he needed B1, B9, and B12. I find it works really, really well. And then energetics D3K2 for 3 sprays. You could do, if you wanted to from standard process, you could do Cataplex B, Cataplex G. You could do the new whole food folate complex, Cataplex B12, folic acid B12. You could test for all of them. I just knew that I wanted to give him 3 things instead of a bunch of things. So I said, let's see if doctor's research tests, and it does. There you go. And energetics D3K2. Sometimes when we test for B vitamins, especially B9 and B12, we actually test for homocysteine. And since his homocysteine was high, we have a homocysteine vial downstairs. We'll put it on the body as another 6th stressor, which I did. And that tested. And so that's one of the other reasons why I knew he needed B9 and B12. Okay. We don't just use blood testing, we also use muscle testing and common sense. The thing that I wanted to emphasize to you with this case study was that, like I said in the beginner course of nutritional blood chemistry, it's a time thing with insulin resistance, okay? If they're diabetic, 20% of their weight, if they're overweight, following phase 1 or the free foods diet, and what will happen is as their weight comes down following a diet, they exercise, their insulin resistance will reverse, especially if you give them right supplements. And then what will happen is the body will heal. So what were his results? Let's see if we can. 10 pounds weight loss in 4 weeks. I think it's a little bit higher than that now. I think he's 15 pounds off. It's like 5 or 6 weeks now. Neuropathy pain is like cut in half. Knee pain is almost in half. Muscle tightness about 30% down. Depression, well, I didn't really ask him about depression. That's something more subjective, but he's like, he comes in smiling now, and he put down his cane. He's happier. Okay. All right. Thank you for attending this case study. This was put together by myself and Laura, my lovely wife. And I would encourage you to go to Sheehan Natural Health and sign up for our newsletter. Okay, you can use those for your patients as well. All right. It'd be nice if you give me credit. If you don't, you're still spreading the good word. Anyway, I'll talk to you on the next time.